Me being related to so many so-called third world countries, Africa, different places where people are dying and you have starvation and even in South America. Now, what is to me? I always thought it was something behind all this focus on health care.
Well, there is, and
Some kind of capitalistic something that's
well, there
wrong.
is. Well, there is
Because,
exactly.
why you want to focus so much on it if the majority of the people don't want it? What do you want to mandate about it?
It's control.
It's control. It's the message of the left is they would
So
like
you're
to
helping
control.
big business in some kind of way.
Not really. You're helping the government. Because once the government controls your life from
No, I'm
birth,
talking about if the government is trying to help big business, what are they trying to
they're
really do?
not trying to help big business. They're trying to get themselves in the business of controlling your health. If they can control...
But why are they, what I'm trying to say is that
It's a philosophy
Yeah, it's
behind
just a
this.
philosophy so people don't really need this health care.
I can't
No,
say
they-
that because too
no,
many
they
people
need
need
it.
the health care.
Yeah, there are people who
We
need
do
health
need
care.
the health care.
Right.
But it's just it just
The manner in
determining
which...
a way and the way to
Right.
do it.
Right.
What I'm surprised that so many third world countries have free health care, free education, and we're the richest nation in the world. We don't have any.
Yeah. Well,
No,
one
we
of the
don't
things
have
we
a-
could do is there are about 10 million people in America who truly do need some expansion of health care availability to
Right.
them. We hear a lot about the 47 million uninsured, but the truth is that when you look at that number, only about 10 to 12 million out of that number are truly in need of some health care benefits that would bridge the gap in their personal circumstances. The other 25 million or so individuals are in situations, for example, with the illegal aliens and people who are in between jobs. These
Say
are
that louder.
Yeah,
because that is something that I really like because I put that on Church, Ohio, because you're saying what they're telling us is that he's got all these people who are sick, and you're saying no, not all of them.
Not
are
at all.
really-
No,
Not
they
at all.
say
Some of
Right.
them, some of
Exactly.
them really.
We said
Some
they're
of them,
uninsured, and they're sick.
well, I'm just saying, some of them, you know what I mean.
Yes,
Some
I do.
of them are really people who just don't want to pay for their health
That's
care.
true.
There are
They
people like
they
that.
There are
deny-
people who don't
Yeah.
want to
And then
do
you're
that.
saying there's 47. Say that again.
Yeah, well, basically, just to summarize, we hear a lot about the 47 million uninsured in America, but there aren't 47 million uninsured Americans. There are 12 million uninsured illegal aliens. There are about 10 million people who elect not to purchase health insurance because they would rather invest the money in their children's education, and maybe they're healthy and don't need to be concerned about that, and they should have that freedom, they should have that choice. There are really, at the end of the day, also about another 10 to 15 million people who are in between jobs, and they're usually uninsured for maybe 3 or 4 months while they're looking for a new job. And the insurance portability feature would address that concern. So when we do the subtraction from the 47 million, we find out there's really only about 10 million people who need some help. And we shouldn't destroy the world's greatest healthcare system in order to help 10 million people. What we should do is find a way to help those people and use the world's greatest healthcare system to do that.
But what about the people who do health insurance and their deductible and stuff has run out and they have nowhere else to consider their treatment? Just like I know a lady now, her deductible has run out on her Medicare, and now she can't pay the full price for her medication. Now, what are you going to do about those people? How will they get help?
That part of that's Medicare D for
Yeah,
the
I guess it's the-
prescriptions. There's a gap. That whole new...
we're
Oh, that's
kinda-
that
we're-
donut they're talking about.
Right, that
Okay.
that needs to
We're-
be readjusted. That can be fixed.
We're running out of time now here, but we need to come back with more topics. I'm so sorry that Mr. Woodrow Wilcox could not make it. He's from Maryville, Indiana, and the weather was so bad he couldn't make it. But we need to come back again with more topics about, health care. You see, because if they pass this bill, another thing I wanted to say quickly about the no bubble zone ordinance, with someone who would really we want to veto this bill. So if you call Mayor Daley's office, that's 312-744-3300, and just say we're going to veto the bill. We cannot afford to have no bubble zone ordinance where you cannot stand out in front of the abortion. You got to be 50 feet away, 8 feet from the people, and they passed that ordinance. So we just don't want that because we want to try to help a lot of the ladies who are trying to abort their babies get alternative services, and we just don't need it. So you can call that number at City Hall, and you can say that we don't want we want Daley to veto this bill. That number is 312-744-3300.
Another point about abortion, though, that I often think about, they're constantly saying the graying of America. So, and they seem to be puzzled about it. But during World War II, they were having babies like crazy, okay?
Mm-hmm.
So that the amount of men that were being killed, we had babies coming into the world that's going to replace them. By the time they went, because every 20 years you're going into war, so by the time the Vietnam War come out, then all the abortion bills were paid, and all the women started having abortions. Well, men were getting killed, and no babies was coming in. So you got babies being killed in abortion. You got people in the prisons. You got our kids all messed up on drugs, and you got 2 wars going on with people being killed. And you wonder about the graying of America, where all the young people are all being messed up and all be either killed or drugged out or something else. So that's what's happening to America.
And even in this Planned Parenthood, they want to, in the bill, they want to set up school-based clinics run by Planned Parenthood, which they already get billions. And they're in court right now for fraudulently billing the government. So this bill...
There's another important thing about Planned Parenthood that people should know about who are watching, and that is the fact that there are lawsuits right now against Planned Parenthood because they are allegedly guilty for...
That's right. We're going to have to wind up here today. But listen, we're going to have another show about this topic, and we just thank you for tuning in. Have a nice day, evening. We'll see you. Bye-bye.
Bye-bye.